According to the Canine Health Foundation, epilepsy is the most common neurological disorder in dogs. The disease is most often characterized by seizures. But what causes this condition, and what can pet owners do to control the disorder? On this episode of the Paw Report, we're joined by Dr. Kari Foss from the University of Illinois Veterinary Teaching Hospital to help us understand canine epilepsy. Stay with us.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Well, we welcome back a former Paw Report guest to this episode. We're joined by Dr. Kari Foss from the University of Illinois Veterinary Teaching Hospital, and today we're going to be talking about understanding canine epilepsy. So it's wonderful to see you again.
It's nice to see you too, Kelly.
We talked when we greeted each other that it's been, 3 years
Yes.
since your last episode, and we
Yes.
talked about hearing loss.
Yes.
Well, today we are going to be talking about canine epilepsy. But first, let's kind of rewind for those viewers that maybe didn't have a chance to meet you the first time around. Tell us about you and your job here at the U of I.
So I am an assistant professor in neurology and neurosurgery in the College of Veterinary Medicine, and most of my work is in the Veterinary Teaching Hospital. And so a little background on me is I actually did my veterinary degree here at the University of Illinois. So I'm an alumnus from this wonderful college. And then to get to where I am today, afterwards I did a rotating internship in small animal medicine and surgery in Orange County, California. And then following that, made the trek back to the Midwest and completed my residency at The Ohio State University in neurology and neurosurgery, concurrent with a master's degree in veterinary clinical sciences. Following completion of my residency training, I then was in private practice in Columbus, Ohio for about 4 years before making the decision to transition back into an academic setting. And so I've been here since 2016, and I'm thankful that I get to be here every day.
Yes, you're doing what you love,
Yes.
and your passion is neurology and aspects of that. And that's why today we're talking about understanding canine epilepsy. And I know a lot of pet owners out there have dogs that have episodes. And so I guess let's start off by saying, what is epilepsy and how is it differ from just having a seizure?
Sure, and that's a great question. And I'll start with some terminology. So a seizure is any short transient event. So not all seizures are epileptic per se. An epileptic seizure is an asynchronous event within the brain, and it's due to asynchronous firing of the neurons or the cells within the brain. And then epilepsy, by definition, is multiple epileptic seizures that are isolated and unprovoked more than 24 hours apart. And I know there's some questions that we'll talk about later on of why that greater than 24 hours apart is really important.
Are there different types of, or different ways to classify epilepsy in general?
Yes, so in veterinary medicine, and similar to human medicine, when we classify epilepsy, we typically will classify it based off of what the underlying cause might be in that patient. So I kind of think about first when I classify the cause, is the cause something actually in the brain itself, or is the issue outside? And so kind of that outside of the brain, and it's not really epilepsy, we'll call those reactive seizures. And so reactive seizures are actually the normal brain's response to some kind of disturbance. And so that can be exposure to a toxin, a metabolic issue, so kind of internal organ dysfunction. And with reactive seizures, those often will actually resolve as long as we treat the underlying cause or the disturbance. And so that's kind of, I put it as its like own little category, because it's not in theory epilepsy per se, but they can be a type of seizure activity. And then as far as our epilepsy, then when I'm thinking about actually a disturbance within the brain itself, one category is going to be kind of primary, or now what we refer to as idiopathic epilepsy. And as far as idiopathic epilepsy goes, that's kind of the general term that we use for many of our patients. But if we want to get specific, that idiopathic epilepsy can then be broken down into what's called genetic. So there's actually been a gene mutation identified for that breed. Suspected genetic, so has not been a gene mutation identified, but there certainly seems to be a prevalence within a breed or some kind of familial predisposition. And then we have epilepsy of unknown cause. And so that's a patient where we've not determined an underlying cause for the seizure activity. And that's kind of the general, again, idiopathic epilepsy, because we've done a complete workup and we've not found a reason for the patient, at least structural. And the other category is what we're going to call structural epilepsy. And so that is when there's actually something physically disturbing the brain tissue. And some of those causes can be a vascular event, so stroke. Brain tumors can cause structural epilepsy. We can see infections or inflammation, and under inflammation we can see infectious causes or immune-mediated, which we call meningoencephalitis. We can see congenital anomalies or birth defects. And then the last one can be something that we call degenerative or inborn errors of metabolism. So the cells aren't processing products properly, and so they're just kind of storing them up inside. That's the degenerative causes are more rare.
Mm-hmm. Let's expand upon the causes. Maybe you could also talk about symptoms or triggers. And you did touch on some of that, but I think the list is probably pretty great on other factors that could lead into episodes.
Mm-hmm. So with our idiopathic epileptics, there's usually not any, again, like I said, any underlying cause for them to have their seizures. You asked about maybe triggers or things like that. So patients, if they had a stroke, maybe they have high blood pressure. Diabetic patients can be predisposed to having a stroke. Patients with Cushing, so too much what we call hyperadrenocortisolism, so too much cortisol in the body can be predisposed, because I love this part with vascular because it's kind of this circle of all these causes, because those patients with that Cushing's disease or hyperadrenocortisolism have high blood pressure, they have protein loss in their kidneys, things like that. They have too much cortisol in their body. We can see kidney disease predispose them to having strokes as well. So lots of other underlying health issues could maybe predispose them to strokes. As far as triggers, we do know that patients, if they're prone to having a seizure, stress or anxiety can also go about bringing on seizure activity. So I think some people have known the dog that never has a seizure except for when it sees the veterinarian in their white coat, that white coat syndrome, or when people come over to the house. Yes, so we certainly know that stressful situations can also trigger those. Not in a normal, healthy dog, but a dog that's already predisposed to having seizures. So not telling people to not let their dogs get stressed. Not every single dog is going to have a seizure, but those that are more prone to seizure activity.
Isn't it amazing the things that you just talked about really can be related to humans as well? Mm-hmm. I mean, everything you talked about is very human relatable.
Yeah.
Now, how do you go about diagnosing canine seizures, epilepsy? If I come in and say my dog had a seizure and I'm petrified, what's kind of the workup to?
Yeah, that's a great question. And the first step is seeing if it truly was a seizure, because there's a lot of mimics of seizure activity too. So patients with heart disease, something called syncope, can look similar to a seizure. Patients with muscular weakness, if they just suddenly collapse, can also look similar to a seizure. So the client is really important in this process of determining if the patient's having a seizure, because we really need a good, thorough history about what this event looked like, and a good description of, was there a trigger? How long did it last? What was the patient doing beforehand? What did they look like afterwards? What did the event, look like? Were they unconscious? Did they urinate, defecate? Things that might trigger us that this was a seizure. Sometimes it's not as straightforward as that. And what's wonderful nowadays is we have all these smartphones, and people have the ability, pros and cons, people have the ability to take a video at any time. So in many of our cases, we also will have the owners obtain a video of the event when it happens, so we can better further determine what the etiology is.
What is the difference between a focalized seizure and a generalized seizure? They're different?
They are different, and so a focal seizure actually arises from just a very specific region of the brain. So only one part of the brain is affected. That being said, we can see the focal seizures then kind of progress and affect both sides of the cerebrum and then lead to a more generalized. And that's actually a very common presentation of seizures in dogs, what we call focal to progressing to generalized seizures. With focal seizures, again, it's going to be based off of the region that's affected. So, and we can see motor activity, behavioral signs, and potentially autonomic, so just maybe drooling, things like that. And with that, it can just be like paddling of one limb or one side of the body. A lot of times the focal seizures might even just be in the facial region. So twitching of the mouth, twitching of the ear, you might see the eye blinking as well. And then our generalized comes from abnormal activity on both sides of the brain. And so the classic presentation, and they can be tonic-clonic, just tonic, so they kind of just will fall over and get rigid, or clonic, where they just stiffen their legs, and then generalized tonic-clonic is they have that motion combined. And again, the classic presentation is those patients typically lose consciousness. They'll have that paddling. They'll still have that focal facial movement as well, so the jaw chattering and hypersalivating, and then they may urinate or defecate during the event as well. And going back to focal seizures, sometimes those can be harder to detect as well, because if it's just a very subtle movement, owners or even sometimes the veterinary nurses might not pick up on it unless we're really specific with saying, hey, this is what this patient does. Really watch for just that subtle activity.
As a pet owner, and I've had a pet that has been through a lot of the scenarios that you've just mentioned, but if somebody's out there watching and for the first time, or maybe the second time, their pet has a seizure, and so what should you tell them? I mean, what should you, as a pet owner, what should you do? Should you immediately call your vet? Should you immediately go to an animal hospital? What's the proper way to respond?
Yeah, and it can be quite terrifying. It sounds like you've witnessed it too. So I would love to say stay calm, but that's just not going to happen, especially if your pet has never had a seizure before. It can be quite frightening. I think the first thing is to just let them come out of it if they're going to. Most seizures last less than 2 minutes, although it seems like a lifetime to the client witnessing it, but most will last less than 2 minutes. So during that time is just to at least ensure the pet is avoiding any potential things that can injure itself on. So it's not getting stuck under furniture or near stairs, or God forbid outside near a pool or things like that, and let them recover. A lot of people, the old wives' tale used to be, oh, they're going to swallow their tongue and they're going to choke on their tongue. That is anatomically impossible to do. So also don't be sticking hands in the mouths of the pet, especially if they have that rapid jaw movement, because we don't want clients to get bit trying to do that. And then once the seizure subsides, the pet might need a little bit of time to recover. They could be a little bit incoordinated, stumbling all over, seem a little disoriented, groggy, things like that. And so kind of just let them recover. Let yourself recover as well. If it's just one single seizure, I don't think there's a need to rush into the emergency room, but certainly I would still recommend having your veterinarian evaluate the pet, because this is something new that's going on, and so to try to make sure that everything's okay. When we recommend patients are seen emergently is when they have 2 or more seizures within a 24-hour period, so that's considered cluster seizure activity, or if they have status epilepticus. And status epilepticus by definition is if the seizure activity lasts longer than 5 minutes, or if the pet has a seizure and really doesn't come to. So the actual kind of movement of the seizure stops, but they're really not regaining consciousness. So those are scenarios where the pet should actually be presented to an emergency clinic to try to get those seizures to stop. Because especially with status epilepticus, I was just in a seminar yesterday on status epilepticus and cluster seizures. 5 minutes is about where we still have that time point to intervene and hopefully get the anticonvulsant medications, the emergency treatments to work. The longer the pet goes in that status epilepticus, the worse it's going to get. About by 30 minutes, that's where we're probably not going to have any interventions happening. Still not wrong to try, but when seizures are going on for more than 30 minutes, that's where we actually can start to see loss of the body's ability to correct itself. They can become hyperthermic, get an elevated temperature, start to have their internal organs affected and things like that. So the second we kind of start to see that prolonged seizure activity, we need to get them in right away.
What does your dog feel? Or when I was watching I had a chocolate lab go through that, it was, you feel so helpless. And are they hurting?
That is another great question, and it is hard to answer because they cannot tell us what they're feeling. It would be great if they could. I would imagine kind of pulling from the human literature, probably more talking after the fact, as they may again feel a little confused. Some dogs get a little bit anxious. Again, they might also be anxious just because we can't tell them what just happened to them. They have no idea. The good news is, in theory, again, they can't say, but again, from people that have these generalized tonic, if they lose consciousness, then they're not aware that that's happening. So if that's a little peace of mind that they're not aware, you know what, I would imagine they may be a little bit, depending on how violent they're, flailing and paddling, could they be a little sore? Possible. I don't find that lasts forever. The dogs don't need any kind of pain medication afterwards. I think the bigger things are just this kind of feeling of anxious, confusion, kind of, again, like, whoa, what happened?
Right.
And some dogs recover just like that after a seizure too, that there's none of that postictal period where they have those signs. They'll just have their seizure and they just pop back up like,
oh, what happened? Yeah, let's go play. I mentioned chocolate lab is what I had that I experienced. Can you talk about the breeds or different, the different types of dogs that maybe are more prone to something, to epilepsy or seizures?
Yeah, and we would love to say that there is a genetic predisposition. A lot of the research and studies have not identified a specific genetic mutation at this point in time, but there's certainly, from clinical experience and research, there are absolutely breeds that are very predisposed to having epilepsy, more specifically the idiopathic epilepsy that we talked about. And some of those are, like you said, Labrador retrievers, border collies, Australian cattle dogs, German shepherds, Vizslas, beagles, Legato Romanolos, that's a fancy one, not a very common one. Belgian shepherds, Belgian Malinois, the list goes on and on. In theory, any dog breed can get idiopathic epilepsy, but those are certainly, and like I said, the list goes on and on about some of those more predisposed, but there are definitely breeds that we see much more frequently to develop epilepsy than in other breeds. One thing I will say is, if you notice, of all those breeds I listed,
large breeds.
Yes, exactly. So I don't think of Yorkshire Terriers, Chihuahuas, miniature. Standard poodles are miniature poodles, not so much. So those breeds are ones that it's not as common to have idiopathic epilepsy. And so if they're having seizures, maybe there's another underlying cause. Not to frighten those owners. It's still possible, but again, the ones that are certainly more predisposed are these medium to large breed dogs.
So pet owners out there may be wondering, what are some of my treatment options? How can I care for my dog if they're going through this? I'm sure there's a load of different options to
There is and is not, unfortunately. So the mainstay of treatment for seizures, regardless of the cause actually, is treat them with an anticonvulsant or an anti-epileptic medication. Unfortunately, we are limited to just a few options in our veterinary patients for what we can utilize, but the kind of first line of treatment is to start them on an anticonvulsant medication with our goal of trying to reduce those seizures by about 50%. And so again, some patients will respond really well, some won't. If there's another cause for it, so a brain tumor or a birth defect, we also need to treat that underlying cause in addition to starting them on an anticonvulsant medication.
Can that be costly? Is that something that, a pet owner would need? When you take on a pet, I think that's what you have to think about, regardless of what their health status is at that point. But I think when you look at long term, you have to think about those things.
Exactly. And it truly depends on the medication. A lot of the seizure medications that we use nowadays can come in generic form, and that's fine as well. So it's not terribly expensive. What can add up in those patients is not just the medications, but in some of those medications, we do need to have frequent monitoring of the pet, just due to side effects that the medications can have on their internal organs, such as the liver and things like that. So it's the medication and then the veterinary visits as well, to have the dog examined and have them have their blood work evaluated. And so kind of over the long term, that can add up for the patient.
And those underlying issues too that have to be treated.
If there is again, with our idiopathic epileptics, or even a patient with underlying diseases in their brain, if they're left untreated, a lot of times what can happen in patients with epilepsy is they might have, a seizure here or there, but over time those seizures can start to become closer and closer together, so more frequent. They can even become longer in duration. And then worst case scenario is they can go into clusters and then potentially status epilepticus if left untreated.
You mentioned earlier in our interview about the power of cell phones and being able to capture, if your dog is having an episode. How important is it for pet owners to keep a diary? So that when they come to your office, they can say, well, I've got this, and I've tracked it, and here's all the days and times and lengths of things that have happened.
This is really important, and I love a good seizure diary. And I think, one, it helps the client or the pet owner feel also involved in their pet's care. But why it's really important for us as the veterinarian treating the patient is, like you mentioned, they can jot down patterns to the patient's seizures, and it helps us determine how well they're responding to a medication. So the seizure log, seizure diary is really important, and there's different ways they can just write on a piece of paper, put on a calendar. I've had clients that, like, one was really cute. They would put like a happy face for seizure-free days, and then like a little sad face for a day that they had a seizure. But it is really good for us to evaluate, because the client kind of comes in and says, hey, I've noticed this is how frequently they're having it. We changed this, and then I noticed that, hey, they did a lot better, and now we're kind of back on our same way. And so then that can be, I can take that information in and say, okay, what's going on here? Why are we having this sudden kind of change? Or, hey, great, we added this medication, now we've gone 4 months without a seizure. Wonderful.
Speaking of changes, what other things could pet owners change in maybe their dog's everyday life that could help? Is it diet? Is it maybe reducing intake of salt or anything of that nature that could help?
So we don't really need to change their diet at all. It's just, being there for them. And I think, again, the things are, if you have an epileptic pet that's prone to seizures, is to at least have it set up that they are blocked from anything that could cause them injury during a seizure event. So potentially gating off stairs, if they could have a seizure and fall on the stairs, not allowing them access unsupervised to the backyard if you have a pool in the backyard, and things like that. As far as, no need to change the diet, but there are a couple diets on the market that are kind of targeted for dogs with epilepsy, because they have a lot of medium chain triglycerides in them. I don't use those as a sole treatment for seizures, but it's maybe an added benefit to the pet as well. So there's Brain Diet by Hills. Nestle Purina has Bright Minds, which that one was actually marketed more towards dogs that are getting older, but it still has some of those medium chain triglycerides in it. And then there's NeuroCare. And so a lot of our epileptic patients, as long as there's not a big food discretion, dietary indiscretion that's going to happen, they don't have allergies or things like that, we'll oftentimes send our clients home like, hey, if you want to try this free bag of NeuroCare, go ahead and give it a try too.
Let's talk about the future, because a lot of what you do currently, and something that's very passionate to you, is research and what you've studied and what you've learned and what you're continuing to do in your research in our last couple of minutes in our discussion.
Yeah, so I'm part of working up a dog with seizures is performing an MRI. And the reason to perform the MRI after they've had their physical exam and neurologic exam is to 100% say, hey, do I see something in the brain that could be causing the seizures? In a lot of our idiopathic epileptics, the good news is the brain's normal. So we don't see any abnormalities, and then they'll have a normal spinal fluid analysis as well, which is great. But that's about all we get from the MRI is normal brain tissue. Yeah. So we're still at the point where we don't completely understand what's happening at the cell level in these patients. In people, they can actually also better identify where the seizure's coming from with what's called electroencephalography. So that actually measures the brain activity. We can do that in our veterinary patients. It's just a lot more difficult. They have a lot more muscle up here than we do. So we get a lot of issues with muscle artifact and things like that. It's also a really, really specialized skill set. I mean, in human medicine, you specifically have people that are epileptologists, and that's all they do all day long is just read these EEGs, whereas veterinary neurologists kind of do it all. So it's not as reliable. It certainly can be helpful to say they're having seizures and help us find it, but I would love to try to find a way with imaging and not so invasive per se to see like what's really happening in the brain in these epileptic patients. And so one of the studies that we're doing right now looks at magnetic resonance spectroscopy, and what that evaluates is actually metabolites of the neurons or the cells in the brain. And so I'm trying to look at epileptic dogs and healthy dogs and see, do these epileptic dogs have changes in these metabolites compared to the healthy dogs, and are those changes predominantly more noted in one area of the brain or one side than the other. And again, the reason for that is in people, they know one of the most common forms of epilepsy in people is called temporal lobe epilepsy or mesial temporal lobe epilepsy. And so we've not documented that in dogs, but some people say, well, is the problem with these epileptics coming from the hippocampus? Is it the parietal lobe, different regions? So again, basic MRI is not going to tell me what's going on in those regions, so can this spectroscopy better identify it? And so then can we provide more targeted therapy? Can I get a better understanding and kind of have these more subtle subcategories of types of epilepsy in the patients as well? And dogs are a great model for epilepsy. They are very similar in people that they just spontaneously develop it. And so dogs have and continue to be used to help further treatments and guide diagnoses for themselves and in people. So I like to say that they really are man's best friend.
Yeah, and you light up when you talk about it. So good luck with your research.
Thank you.
And thank goodness for veterinarians like you that are really putting your heart and soul into finding out the reasons behind these episodes.
Yeah,
so.
This is why I love what I do, is not only do I hopefully someday get to help the pet population, but our pet population can also help the humans.
That's right. Good way to end our interview today. Dr. Kari Foss at the University of Illinois Veterinary Teaching Hospital here in Champaign-Urbana. Thank you so much for joining us today.
It was a pleasure.
We won't wait 3 years till our next interview.
Let's not.
And thank you, our wonderful viewers of the Paw Report, for joining us for this episode. Until then, we'll see you next time.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.